If you're dealing with constipation, you may have heard of a medication called Docusate Sodium-Senna. This medication contains two active ingredients, Sennosides and Docusate. Sennosides are stimulant laxatives that work by keeping water in the intestines, helping to move things along. Docusate is a stool softener that increases the amount of water in the stool, making it softer and easier to pass. This combination can help relieve constipation and get things moving again. For best results, it's important to take Docusate Sodium-Senna as directed by your healthcare provider. Typically, it's recommended to take this medication with a full glass of water and to allow for 6 to 8 hours for its effects to take place. Always follow the recommended dosage and don't take it for longer than instructed without consulting your healthcare provider. When taking Docusate Sodium-Senna, it's important to follow the directions from your doctor or the product package. Be sure to take it with a full glass of water. The dosage will depend on your age, medical condition, and how you respond to the treatment. It's crucial not to take more than directed or use it for more than 7 days without your doctor's guidance. Serious side effects can occur from overuse. It may take 6 to 12 hours before you experience a bowel movement after taking this medication. If your condition doesn't improve or if you experience rectal bleeding, contact your doctor immediately. Some common side effects of Docusate Sodium-Senna may include stomach pain, nausea, diarrhea, or weakness. If these effects persist or worsen, it's important to consult your doctor or pharmacist. This medication may also cause your urine to turn reddish-brown, but this effect is harmless and will go away once you stop taking the medication. If your doctor has prescribed this medication, it's because they have determined that the benefits outweigh the potential risks. Most people using this medication do not experience serious side effects. However, it's important to seek medical attention if you experience persistent nausea, vomiting, diarrhea, muscle cramps, irregular heartbeat, dizziness, decreased urination, or changes in mental/mood. While rare, a serious allergic reaction to this drug is possible. Seek immediate medical help if you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so it's important to contact your doctor or pharmacist if you notice any other effects. Always consult your doctor for medical advice about side effects. Before taking Docusate Sodium-Senna, make sure to inform your doctor or pharmacist if you have any allergies to Senna, Sennosides, or Docusate, or if you have any other allergies. It's important to discuss any inactive ingredients in the product that may cause allergic reactions or other problems. Additionally, before using this medication, inform your doctor or pharmacist about your medical history, especially if you have a history of appendicitis, sudden changes in bowel habits lasting longer than 2 weeks, bleeding from the rectum, or intestinal blockage. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For pregnant individuals, it's not recommended to use this medication for long periods during pregnancy. It's important to consult your doctor for more details before using Docusate Sodium-Senna. This medication passes into breast milk but is unlikely to harm a nursing infant. It's important to consult your doctor before breastfeeding while using Docusate Sodium-Senna. When taking Docusate Sodium-Senna, it's important to be aware of potential drug interactions. This means that other medications or products you are using could affect how Docusate Sodium-Senna works, or could increase your risk of side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Docusate Sodium-Senna is mineral oil. It's important to discuss any concerns or potential interactions with your healthcare provider. If someone has taken too much Docusate Sodium-Senna and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. Symptoms of overdose may include uncontrollable nausea, vomiting, or diarrhea, as well as severe stomach pain or cramping. It's crucial to get help right away in these situations. Make sure to keep all of your medical and lab appointments. To prevent or relieve constipation, making some lifestyle changes could be helpful. This includes exercising, drinking enough water, and eating a proper diet with fiber-rich foods such as bran, fresh fruits, and vegetables. It's important to talk to your doctor or pharmacist about any lifestyle changes that might benefit you. If you are taking this medication regularly and you miss a dose, take it as soon as you remember. If it is close to the time for your next dose, skip the missed dose and take your next dose at the regular time. Do not take a double dose to make up for the missed one. When it comes to storing Docusate Sodium-Senna, it's important to follow the instructions on the product package or ask your pharmacist for guidance. Make sure to keep all medications out of reach of children and pets. And remember, don't flush this medication down the toilet or pour it into a drain unless specifically instructed to do so. When it's no longer needed or has expired, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.